In this video, we'll discuss about Tecovirimat. So this Tecovirimat, which is also known as TPOXX or ST246, is a novel antiviral drug that is stockpiled for smallpox preparedness. It is FDA approved for smallpox. However, it has been used for the treatment of other orthopox virus infections like monkeypox, and this use is investigational. So now let's talk about the mechanism of action of this drug. It's an antiviral agent that inhibits the viral spread to the uninfected cells, and it does so by inhibiting the activity of this BP37 protein that prevents the formation of the egress component envelope variants, which is necessary for the dissemination of virus. So while talking about the pharmacokinetics, this drug is absorbed better if it's taken with a fatty food, and the half-life of elimination is around 21 hours if the IV route is used and 19 hours after oral injection. Time to peak is 6 hours. Protein binding is around 77 to 82%. Excretion basically occurs through urine and feces. So now talking about the use of this medicine. So it's basically FDA approved for the use in smallpox. However, recently it has been used in MPOX, and this use is off-label use, not approved by FDA. So it's not used for all the patients with MPOX, but it's used in the selected patients with or at the risk of severe disease. And for those infections in the anatomic sites that may be associated with severe pain or result in the sequelae like scarring or strictures. And it can also be considered for post-exposure prophylaxis on case-by-case basis in consultation with CDC. It comes in two forms, capsules and injection. For MPOX, it can be used both IV and oral, and the dose is based on the weight of the patient, and those can range from 200 milligram every 12 hours to 300 milligram every 12 hours based on the weight, or in oral form the dose can range from 600 mg every 12 hours to 600 mg every 8 hours based on the weight of the patient. So this medicine should be taken with the higher moderate fat diet because that increases the absorption. And the duration of therapy is basically 14 days, but it can be individualized based on the clinical response and the tolerability of the patient. For the dose adjustment, we need to know a few things. For the kidney impairment, if the creatinine clearance is less than 30, the use is contraindicated. Otherwise, it can be used in kidney impairment as well, and there is no dose adjustment required for the liver impairment. So some of the common side effects are headache, vomiting, nausea, and some other rare side effects include tachycardia, rash, dyspepsia, diarrhea, arthralgia, photophobia, and pain at the injection site. So the contraindications, as we have discussed, severe renal impairment with creatinine clearance less than 30 ml per minute is a contraindication. Similarly, if patient is hypersensitive, has shown hypersensitivity reaction to the Tecovirimat or any component of the formulation, then it should never be used in the patients. Let's talk about the evidence for the use in MPOX. So there's very limited data available. So the use in the MPOX is basically investigational, and currently STOP trial is undergoing, which is trying to identify the safety and efficacy of this drug in treating MPOX disease. Tecovirimat is available for the treatment of MPOX via the STOMP trial, or patient can get it from the CDC through expanded access investigational new drug application. So regarding the pregnancy and breastfeeding, limited data is available, and Tecovirimat can be used in the pregnancy and breastfeeding if other indications for the use are met. So these are the references which we use for making this video. Thank you so much for watching. Subscribe to our channel for more videos.